Hello, my name is Carl Orr and I'm a consultant rheumatologist. Rheumatologists care for many people who have arthritis. The word arthritis is used to describe a set of conditions primarily affecting the joints. There are over 100 different types of arthritis, but 3 or 4 different types you'll be much more familiar with, and you may even know the names of these. The condition as a whole is extraordinarily common in Ireland and around the world. In fact, the word arthritis comes from the Greek words for joint and inflammation, and this gives a clue as to the underlying main problem in those affected by the condition. Essentially, those affected have inflammation of their joints, and inflammation causes pain, swelling, stiffness of the joints involved, as well as having an overall effect on the body as a whole, as well as the mind, and often making people with the condition tired, experiencing poor appetite, and even feeling depressed. In some types of arthritis, the inflammation, if left untreated, can lead to damage of the joints and the structures around the joints, and in time this results in deformities and loss of function. It is very important to note that not all inflammation is the same. In fact, the most common type of arthritis, osteoarthritis, is very different from many other forms of the condition. In osteoarthritis, the problem appears to be damage to the cartilage within the joint. The function of cartilage in joints is to act as a shock absorber, to distribute the force of movement evenly, and to reduce friction within the joint. Damage to cartilage occurs simply from using the joint and gradually increases over time. Everyday mechanical forces ultimately slowly damage the cartilage. Occasionally you may hear the term degenerative joint disease used to describe this. Unlike other parts of the body, the cartilage does not have a blood supply, and it is therefore not very good at healing itself. The damage of the cartilage encourages the development of a low-grade inflammatory response, presumably in an effort to promote healing and regeneration. This low-grade inflammatory response is in part responsible for the pain associated with the condition, and is likely, in fact, a contributor to further degeneration of the cartilage. Some people are more prone to osteoarthritis than others, and there is undoubtedly a genetic component to this. Joints that must carry our body weight are commonly affected, including the knees, hips, and the many joints in our spine. Although there are no specific medical treatments for this condition, it is reassuring to know that the process is usually very slow, and there are a number of things people can do to help prevent osteoarthritis and to slow its progression if they already have it. These include taking regular exercise, maintaining a healthy diet and weight, and performing exercises which strengthen the structures around the joint which support the joint. Occasionally painkillers may be required, and there are a variety of options should this be the case. Finding a medicine or other strategies that can prevent or slow down this type of arthritis is the focus of a great deal of research, and there have been some exciting developments in recent years. The other types of arthritis generally are characterized by a much more potent inflammatory reaction within the joint. In the case of gout or pseudo-gout, for various reasons, microscopic crystals, which are a product of our metabolism, accumulate in the joint. When our immune system sees these crystals, it recognizes that they should not be there and quickly organizes a very severe inflammatory reaction, which it hopes will rid the joint of these crystals. Unfortunately, the crystals are not easily cleared by immune cells, and so the reaction continues, and the immune cells cause toxic chemicals to be released into the joint, which makes the problem worse. It is very important to note that in this instance, the immune system is in fact behaving quite the way it should. It is seeing something that should not be there, and it is trying to solve the problem. Again, some people are more prone to this than other people. For these types of arthritis, collectively called crystal arthritis, there are some things people can do to prevent. For example, in gout, changing diet, reducing weight, reducing alcohol, and taking regular exercise helps a great deal. Sometimes medicines people are taking for other reasons contribute to the formation of these crystals in the joints, and these may need to be changed and alternatives sought. Often anti-inflammatory medicines are given during an episode, and occasionally medicines that prevent the accumulation of crystals in the joint in the first place are commenced. These medicines in gout are extremely successful at preventing any further attacks. Finally, some types of arthritis are caused primarily by misbehavior of the immune system. Taken together, they are referred to as inflammatory arthritis. There are a lot of different types of arthritis caused in this manner, but two of the most common, which you may have heard of, are rheumatoid arthritis and psoriatic arthritis. In these cases, for complex reasons, many of which we are not yet entirely clear on, the immune system is being triggered by something to cause inflammation of the tissues within the joint. Sometimes the tissues immediately surrounding the joint can also be affected, and occasionally even tissues quite far removed from the joint can be affected. It is important to emphasize that this inflammation is not a normal response and should not be happening. If you think about it, the immune system is there to protect us from infection and to begin the healing process after infection or injury. Inflammation is actually its primary tool to do this. But in these conditions, there is no infection, but the immune system is causing inflammation anyway. If untreated, this type of joint inflammation almost always causes damage to the joint structure, leading to deformity and loss of function in time. Unfortunately, there is no cure for most of these conditions, but thankfully, most people, especially those who have developed the condition over the last 20 years, do very well. There are a lot of medicines now available to treat these types of arthritis. Each of these medicines act in some way to redirect the attention of the immune system from the joint so that the immune system functions more appropriately. These medicines work very well both at reducing the symptoms of arthritis, but also at reducing and often even stopping any joint damage occurring. They are safe, generally well tolerated, and have been studied extensively. While the strategies mentioned earlier, like exercise and weight management, are also important in treating these types of arthritis, for most people with these conditions, they will be advised that they should be on a continuous treatment. So, to conclude, there are many different forms of arthritis, and occasionally specific treatment is required.